Hi, I'm Dr. Byrne with Desert Sky Urology, and we're about to do an office trial of sacral neuromodulation. You'll hear it referred to as the InterStim sometimes, and it's an excellent treatment for management of overactive bladder, urge incontinence, and even urinary retention, and it can also improve fecal issues in some patients as well. So the nice thing about what we're doing here is this lovely patient is actually awake, and this is a quick office procedure, and it's a trial. So first we see if it works for her. She tries it for a week or so, and no commitment. If it works great, which we want to see at least a 50% improvement, then we do a formal implant, which is done in the operating room. So we're under sterile conditions here, and we're going to get going. So the first thing you're going to feel is I'm going to write on you first. So I mark my little spots here so that I have a basic guide of where I'm headed. So I'm feeling for the bottom of the sacrum, sorry about that. And then I measure up about 9 centimeters-ish, which is just general anatomy, but there's gonna be some variability there. And then now I'm gonna inject the skin with lidocaine, make it a more pleasant experience for you. So you're gonna feel a poke and a burn, okay? And I go a little bit above where I wanna enter into that sacral foramen, which I guesstimated was gonna be right at that level. So we'll see. Then you're gonna feel some pressure as I'm trying to find the spot here. And then we test it. Let me dry you off a little bit here. We test it and ask her if she feels the sensation at the correct location.
Turning up the stimulation. Feel anything here?
Yeah, a little bit, but it's more in my hip than in my
Move it around. Or...
vaginal area.
Okay, I'm gonna move it around a little bit. Tell us if you feel anything different. Might need to be deeper. So we might be in the S2 spot, so we're gonna try and manipulate one foramen down and try that again.
Turning up. Feel anything here?
No.
I'm gonna dust further in.
Okay. So I might need to use the other needle.
A longer one? Okay. All right, I'm gonna do the same thing on the other side, okay? Poke and a burn, all right? Sorry.
I'm sorry.
You're doing really great with this. Another poke. And then same thing, you're gonna feel pressure, and when we think we're in the right spot, we'll test it. So we have a little bit longer of a needle here to make sure we're getting far into the foramen as we need to. She has great anatomy because it's dropping right in.
Testing.
Yes, now I can feel it.
Tell us where you're feeling that.
In the vaginal area.
Perfect.
Nicely
So
done.
that answered our question. We just needed a little bit longer of a needle, so we're going to switch that over on this side. Okay, so I'm going to remove this and probably can go in the same location. I just need to get a little bit deeper. And then sometimes we have to feel around until we feel it drop in, which that felt like it dropped in nicely, but then you also want the reassurance from the patient that she's feeling the stimulation in the right place.
Testing.
Yes.
Okay, success.
That looks even stronger.
Okay, great. Now we're gonna put the wire in, so the needle is the finder for the foramen, and then we just use that to lead our wire to the right spot. And then these two flimsy wires are what is going to be taped in place. Hopefully it'll last 7 to 10 days is ideal. And then she'll come back and tell me if she loved it and it was life-changing, then we'll arrange for the implant. And if not, we'll circle back because there are lots of treatments for management of overactive bladder, urge, and urge incontinence. So
Yay.
we don't give up till we get there. So you see how small those wires are, and they're soft, so patients tolerate really well just having these taped in place for a week or so. So we're
That's
gonna
so
get
cool.
everything secured, and that's it. Thanks for watching.